please.
Good morning. My name is Dr. Gietz. I am a Vice President of JT International. I speak for my company and our parent, Japan Tobacco. We are the third largest international tobacco company. Given the extreme time constraints, I will concentrate on 3 points. What we do to address the health risks of smoking and the widespread misgivings about cigarettes. Where we can and wish to work with national governments and public health authorities, and where we think tobacco control advocates are misguided. Tobacco is legal, but it is also controversial. We openly acknowledge the health risks of smoking. We are willing to shoulder the special responsibility that comes from the product we make and sell. And what we do is much more important than anything we say. Tobacco is already highly regulated on a national level, and rightly so. We welcome sensible and meaningful regulation extending to the following fields. We believe the smoker has a right to know about the risks of smoking, also to know what is in cigarettes. We agree to reasonable marketing restrictions, but we do still wish to be able to communicate with adult smokers about a legal product. Let me make one thing crystal clear. We do not want minors to smoke. We aim to eradicate this huge societal problem, but anything we can do will not be enough. We therefore ask all other parties, governments, trade, educators, parents, and yes, the WHO and public health authorities, for their help. We support efforts to protect non-smokers from the annoyance of tobacco smoke. We cooperate fully with law enforcement agencies to fight smuggling and counterfeit. We do not benefit from these criminal activities. We deplore them as much as anybody else, but we alone cannot win this war. Most important of all, public health authorities have concluded that smoking causes or contributes to certain diseases. We translate this into a mandate of developing cigarettes that reduce the health risks of smoking as much as possible. On all these issues, we see not only room, but a positive need for cooperation. However, cooperation can only be successful in the interest of smokers if based on realism. Every sensible regulator in the world knows smoking cannot be uninvented. Bans, let alone prohibition, cannot be the answer. Smokers will still want to smoke. Therefore, let us address together the problems we are jointly concerned about. Let us work together to ensure people understand what this product may do to their health and know what is in it. Let us work together to prevent underage smoking. Let us work together to combat contraband. Let us work together. There are, however, core issues on which we fundamentally disagree. First, advertising bans do nothing about smoking incidents, including minors, as solid empirical evidence shows. Equally, the theory that raising taxes will lower consumption is wrong. Unreasonably high tobacco taxes lead to a black market and to losses in fiscal revenue. Again, we deplore this, but it is a fact of life. There are no silver bullets. For instance, abolishing descriptors such as light and mild, while seeking to improve consumer information, does not make sense. Let's just tell smokers that light and mild, that descriptors denote differences in taste, no more, no less. National governments are best positioned to know what measures will work in their country. A one-size-fits-all solution for the planet is inherently flawed. And national governments have the democratic legitimacy to pass laws within their borders. Maybe the biggest flaw underlying all tobacco control activities is the demonization of big tobacco. What would a world look like where people still wanted to smoke, but we would no longer be there to meet that demand? No control over what is in the product, no information on the product, no tax revenue, a huge criminal infrastructure, and a vast increase in underage smoking. Is this what you want? The notion that putting us out of business will benefit public health is a concept born in the ivory tower. Instead, we invite the WHO and all other health authorities to work with us and the elected governments to protect public health in a world where 25% of all adults will still continue smoking because they want to do so. Thank you. Yes.
I'm interested in that the tobacco industry now accepts that smoking does cause disease. Am I correct?
We agree with the conclusions drawn by public health authorities.
My question is, what are your responsibilities to your customers? Will you be compensating them for the harm caused?
I don't think that is our role. Our role is and has been all the time to translate what external scientific and medical research has come up with in terms of what can this product do to smokers' health. And as I said before, our obligation, our scientists' role is to translate that into developing products that reduce this risk as much as possible.